That's you.
Okay. Welcome, everyone, to another episode of the Surdentity Podcast, coming to
Yay.
you from Key Largo in Florida. It is warm here. And today I have with me the great, groundbreaking, amazing Dr. Chris Kammer, a great friend of mine and a very forward thinker and somebody who's really doing something about dental trauma.
Right.
He doesn't use a drill. He is the founder of what the AAOSH,
Well, yeah, the American Academy for Oral Systemic Health, for oral and systemic health is how we
right?
call
But also drop the drill. So
it.
you don't use a drill. Like, how does that even work?
First of all, let me just give us a little intro here. Hey, everybody, it's time for the Surdentity Podcast Show. Yeah.
I love it.
All right. So now we got
Surdentity
that.
Podcast Show.
Hey. Should have had my cool shades on for that. Hey. Okay. But anyway, so let's see. What would you like to know? Where did it all get started, or how do I do dentistry
So,
without a drill? Or
you know, so I've been talking about dental fear, okay, for 30 years.
yeah,
And dental fear is still a thing in 2024. People
yeah,
are still being traumatized
yep,
in the dental chair.
yeah,
And what I love about Drop the Drill is it's a completely different approach to to care in the mouth. It's dental care. I kind of hate that term because we're not just working on teeth. We are working on human beings in the most sensitive area of their body. And you know,
no, I get it, and it's like I think when people make their lists of the least favorite places they'd like to show up at, dentistry is usually in that top 10, maybe in the
it's
top three. I don't know, but my whole career I've been dealing with, and I didn't mind dealing with it. I try to be very caring and compassionate person, and I
yes.
and I I try very hard over the years with kids, adults, seniors, everybody in between to make dentistry kind and gentle as much as humanly possible. So the profession's made major strides in those areas, but bottom line is so that's nice. But when you practice without a drill and without shots, that's even better.
Yeah.
And the reason I do that is because it's not necessary to stop dental disease, to stop caries, to use a drill and cut it out or amputate the diseased tooth structure. And if you don't have to use a drill, you certainly don't need a shot. So what I've been doing is using what I call it, well, what I don't call it. I learned this from other people. The medicinal management of caries is where it's like the medicinal management of your strep throat, Beth.
Right.
If you get a strep throat, your doctor's not going to say, let's see, Beth, we got a strep throat there. All right, well, give me my scalpel. We're going to cut it
Right,
out.
right.
We're going to cut that out, and then that'll take care of that diseased strep throat. But that's what we do in dentistry. We cut
Yeah.
out the diseased tooth structure instead of using medicine like we do in the medical realm,
Mm-hmm.
antibiotic to heal, to kill the infection, kill the bacteria, and halt the infection, and then we're fine, generally. And then we can do that with teeth. We can use a medicinal antibacterial uh, not even a prescription, but it's mostly dentists that are using these things. But it's like it's like a prescription strength medicine to use on the bacteria, kill the bacteria of tooth decay, and then simultaneously harden it so that you don't have to cut it out and replace it with something artificial. That's sort of
Wow.
what we do.
So, remember back in the day, the preventive resident restorations, they were like deep sealants.
You mean like the ones where you would open up a groove, you mean, or
Yeah,
something?
yeah.
Yeah.
Those didn't seem to work very well, or they got a
Well,
bad reputation.
so sealants are usually done, resin, they're plastic. They're not bacterial. So they start to wear away, they can leak, they can continue the problem. The only thing that really does take care of the problem, is this SDF, this silver diamine fluoride medicine
Mm-hmm.
that will kill the bacteria of tooth decay. And a glass ionomer will do a similar thing too, because it'll seal the area and suffocate the bacteria. Or no, well, that's suffocate. Well, it'll remove all of its substrate. You won't get any
Mm-hmm.
chance to eat anything to spit out the acid to soften the teeth.
Mm-hmm.
So I don't know. It's like I'm just so bottom line is we don't have to drill. In fact, I would say maybe 90, well, let's be conservative. Let's say 75 to 80% of all the drills that are being put into teeth on a daily basis in America can alternatively be treated with a medicinal approach.
Wow.
SDF, which is this antibiotic silver ion medicine that
Mm-hmm.
can soak into the teeth, find the bacteria, kill it, and then it follows. Then the fluoride follows up and hardens the tooth structure. And that the interesting thing is, your tooth structure once it gets hardened with SDF becomes harder than it was originally. And by keeping those silver ions in the tooth, they stay there and they'll kill the next little bit of bacteria that thinks it even wants to, enter into that space. So there's a
Right.
long lasting effect. And this is way better than any filling on the dental market. There isn't a single filling you're going to put in teeth that will do that, like SDF will. And if you follow up your SDF with a glass ionomer restoration, which is a glass particle
Mm-hmm.
film, um, you've got a 96% chance of reducing the risk of decay. Ain't nothing on the market that can do that. There's no filling that can do that. There's just nothing. So and John Frashella calls that combination therapy. I like it. It's true. So,
Yeah.
you're getting the best of one world, which is two treatments of SDF uh, solution and I typically, having learned this from my mentors, we seal it with a fluoride varnish, so at least it just
Mm-hmm.
stays where it is for a while, soaks in as much as possible, and then
Mm-hmm.
cover that at some point with a glass ionomer cement filling or glass ionomer restoration that fuses to the tooth structure, creates a zone of caries resistance. That zone between the glass ionomer filling and the tooth is part glass ionomer and part tooth. They fuse, they become one. That's the most cavity resistant barrier margin you're ever going to have. And once again, no other filling can do that. So to me, this is just an automatic, should be standard of care kind of a thing. So
Why isn't it? Why is it not the standard of care? Why are we still drilling
that's an
teeth?
e that's an easy answer. I
Hmm.
mean, it's because dentistry is a very conservative profession, and one reason is, that's the way they were taught. They're doing it the way they were taught in dental school. They're doing it the way that they had to do it to pass their dental boards.
Yeah.
Everything that led to their being turned out to, and turned loose on the public, it's ingrained in them that there's a certain way to do it.
Yeah.
Because that's how I got out of dental school. That's how I passed my boards. And they're also afraid of anyone else thinking, if you're doing something a little bit different than what we're all doing, we're going to have to figure you out because you're probably doing
Right.
something wrong. There's a little bit of that, but I got over all that stuff a long time ago.
Yeah.
So
Well, and the same thing with dental hygiene. I'm retired now, but I was a hygienist for 8 years. And it's like you got this tunnel vision, right? Like, oh my God, tartar. Like you gotta like get the tartar. And if in dental hygiene school, if you killed the patient, it was fine as long as you got the tartar off.
get that last little spicule of
Right,
tartar,
right,
that last little microscopic piece of,
right.
calcified plaque. Yeah, and anyone that all the experts will say is that you're not going to get it all.
Right.
we go, all the hygienists are going in there and using their ultrasonics and their planers and scalers and all those fancy named tools, and they're not going to get it all. Now,
Yeah.
and here's the other hard part about that I have an issue with. In their efforts to get it all, they get a lot more than the tartar. They
Mm-hmm.
they scrape away a lot of enamel. In
Mm-hmm.
fact, that will make its way into my presentation because I'm one of those people that,
Mm-hmm.
that where burnished calculus was gone after, and so enthusiastically. I have some interesting. My interproximal spaces look very interesting. Anyway, so yeah,
Wow.
I've lost to, well, cementum to structure, yeah, due to aggressive removal or aggressive attempts at removal of burnished calculus. Okay, so in the same way, Beth, that I like what I'm doing with caries, cavities, a medicinal approach.
Mm-hmm.
Wow, there's got to be a medicinal approach.
There is,
Well, I know there is almost there, this the gasification modalities now where we're using these solutions to dry out all the moisture from the tartar and from the tissue. You get less bleeding when you're in there cleaning, and it's easier to remove the tartar. That's what I think is the best that's out there so far. But you got a better idea. I
oh,
want to
yes, I
know.
have a better idea. How about it's not about anything, it's not about the tartar. Okay, it's about the bacteria. So um we have to balance the biome. It's all the all it's not all bad. So we have to balance the biome. We have to teach the patient how to keep the biome balanced. I'm very excited about
So I'm your patient. Tell
okay.
me in 3 sentences how I balance my biome.
Hi Chris, how are you doing today?
Hey, you just used up one sentence.
Okay.
Well,
So we have to target the bad bacteria, and we target that with xylitol. And there's a wonderful product called Fossident that is an oral prebiotic that you're going to start seeing more of that. We don't Listerine, chlorhexidine, all that stuff. That's like napalm. Okay, we don't want to kill everything. We need a balance.
yeah,
We
but we
want
know
to
it's all going
create
to come back too,
homeostasis.
right? It's
Huh?
going to come back. I mean, I understand that a rough surface is going to attract bad bacteria, find a home in the rough surface. So I get that part. But I'm looking for something that I can just uh, squirt around the tooth that will dissolve all that stuff and wash it away. Well, the Perio DT is a product that's out now, and it is about the closest we've got to that. Although it does not dissolve the tartar, but it does make it much easier to remove. Uh,
Perio DT.
yeah, Perio DT. It's Young Dental. It's a product of theirs, and I'm just starting. I've been using it for a couple of months, and I've just started seeing some podcasts and some webinars being put on about it. What it does is
Oh, okay.
it's
Yeah.
more of an
Yep.
it's more of an adjunct to
Yeah.
your periotherapy. But I have found, and I'm not a hygienist, and so, uh, but I have found when I'm personally trying to remove the tartar for my patients when they're in for a visit, uh, it does remove it very very nicely. And here's the really cool thing: because it's a desiccant, which means it dries up everything.
Mm-hmm.
It even dries up those puffy on fire bleeding gums. You
Mm-hmm.
don't have that bloodbath that you would normally have
Mm-hmm.
when you're
Mm-hmm.
removing tartar. If you even touch the gums, it's like blue, like
Yeah. Yeah.
so that's a great product. So what I want to do is what I'm doing medicinally for the teeth. I want to do it for the periodontium. I think we're getting close. I'm always concerned about and I'm a big fan of xylitol, have always been a
Mm-hmm.
big fan of probiotics. I love
Yep.
starving out the bad bacteria
Yeah.
by building up the good bacteria, so that's good. These are all ways. Um, and then there's all kinds of things. There's lots of podcasts. I just listened to one yesterday. The number one biological dentist in the country is talking about the exact right diet to have.
Yeah.
And kind of going back to how when we were cave people
Well,
and
we don't have to chew anymore. We don't have to
example,
chew. So our diets are too soft and there's too much sugar. That mastication is cleaning.
yeah,
When you're
yeah.
masticating, when you're chewing, you're, you got saliva. I try to tell my patients, saliva is a digestive enzyme. When you don't chew your food, you're missing out on the first stage of digestion.
Mhm.
And we have to chew. I also think that when you're chewing, you're also helping your brain, because when these muscles are chewing, you're getting your cerebrospinal fluid. You're helping to get that around the brain. When I was working in nursing homes, that often occurred to me, like, these people aren't chewing at all. How can we expect their brains to you know to not deteriorate when they're not even doing the basics?
You bring up a really good point, especially when we're talking about chewing or eating in the nursing home. And I visit nursing homes every single week, and I'm working with these modalities with nursing homes, and I it makes you sometimes think about that end of life stage,
Yeah,
that
yeah.
last phase, and so mealtime is so important because there's not a lot to be joyful about. I mean, as I'm viewing now, they
Hmm.
do wonderful things and they sing songs and they have gatherings and they
Hmm.
have discussions and they have a lot of beautiful people that are in charge of leading this fun things that they're all doing. It's like camp, I mean,
Right, right.
it could be fun and maybe when I'm there someday, we'll be doing music trivia and hopefully I'll do really well. But or maybe I'll be the DJ. I always thought if I was going to go to an assisted living community, I would want to be the DJ,
Yeah,
and just we'll
right.
stir it up every afternoon, or maybe once a week. I don't know, but I but what I wish more people were interested in visiting the nursing homes to help them with their care, and I know one of the reasons they're not is because what do? You either got to transport them to your dental office, and that's almost out of the question. It's too complicated, too hard.
Hmm.
Um, there's lots that goes into that. And then it's stressful on the patient. And then dentists don't even know, because I've been one of those dentists, don't even know
Hmm.
what to do. Like, where do I start?
Right.
Well, once you get into assisted care, the care is very inconsistent in terms of their oral health. The aide might have a list of 10 things to do for that resident every
Right.
day. And by the end of the day, it's like, I don't know if I got enough energy to do it. Let's do a quick brush of the teeth, or hopefully they even do it at all.
If at all. I did nursing home dental hygiene for 13 years, and I once a month would speak to the new nursing hires, a little presentation about oral care. And you know the level of uh you know no knowledge of the mouth, as attached to the body.
Yeah.
And even people who tried, uh it's so difficult. It's so difficult.
Well,
That's how I figured out about retained primary reflexes, was working with nursing home patients. When I would, you put your finger and they turn this way, or you put your finger here and they close around it. These are primitive reflexes that have returned due to their cognitive, their brain function. They're going backwards. And I first observed that in the nursing home, and I was like, wow, this is a reflex. They don't know that they're doing this. And then as I started to look at my patients in the regular office, I was like, they don't even know they're doing this. Like when they tighten up the lower lip and the cheeks come in, and on these Facebook groups, everyone's complaining and complaining about these uncooperative patients. And what I'm trying to tell them is they don't know they're doing it. Okay, they're not doing it on purpose to make your job harder.
Well, I think I would think that anybody in a reasonable state of mind would go into a nursing home situation and kind of expect a limited degree of cooperation. Now, when
Right.
you get great cooperation, that's awesome, and sometimes you
But
do.
it hardly happens.
But there's things you can do and persevere and be kind and and then the other thing is you do the best you can. Whatever you're able to do is going to be better than nothing.
Mm-hmm.
And if you're having trouble delivering oral care, imagine what the nursing assistants are going through every night.
Oh,
So,
yeah.
so since we're having this discussion, it is my belief that it should be mandatory upon entry into an assisted care facility if you're not able to do your own home care, and many in the independent living areas are, they do their own. But if you're the point where you're getting a lot of assisted care with
Mm-hmm.
your oral care routine, your nighttime oral care routine, um, then I've seen tens of thousands of dollars of dentistry be undermined and
Yes.
ruined in less than a year.
Yep.
So to me, it's okay. What are we going to do to protect those margins, to protect those teeth? Mandatory full mouth, 2 treatments of SDF, and at
Yes.
every exposed gingival third, which is that gum line area
Yep.
below the margin of the crown. Sometimes the gums have receded, and all the plaque collects in there.
Yep.
I'm not so worried about where the crown's over the tooth because that's all kind of protected by the crown. But the minute the gums drop down a little bit, there's
Yep.
some tooth structure, and like a chainsaw, the decay starts working its way through there. So we treat that. We stop the bacteria with the SDF and seal it with the glass ionomer cement. You know how long that takes to do? I mean, I squirt a little glass ionomer on my finger and I
Mm-hmm.
push it on
Mm-hmm.
the teeth like that. And then I let it, start to set. And then I just scrape it away with an Explorer and it's done.
Yeah.
I mean, it's so that's what I would like to impress upon my colleagues that it's easier than you could possibly imagine to
Mm-hmm.
deliver the most necessary preventive care that they could possibly ever get. And it's kind, it's humane, there's no shots, there's
Right.
no drilling, and that's going to go a long way to helping them preserve their teeth while they're in a residence where their care
Right.
assisted care is inconsistent, and that's being kind to say
Yeah,
it's
that's being kind. Well, and xylitol, a pink sponge and xylitol gel. If every patient got swabbed with
Yeah.
xylitol gel once a day, you would see remarkably improved hygiene. Um, that's what when I had patients at the nursing home, I could have, I had a clinic and I had them bring the patients down, but as I continued to work there, I realized that what this is, I got to go to these people. I got to go up on the floors and just go around with a pink sponge and swab. So when I did, a cleaning, I hardly scaled at all. I used an end tufted brush with xylitol gel, and I would just debride, and use the suction in this hand and the brush in this hand, and just debride their mouth. And
Well, there's so much that can be done, and it's not as complicated as you might think, and you don't have to feel the pressure to deliver ideal care because ideal care, the definition of ideal care changes when someone's in a assisted care
it's
facility. Ideal care
palliative.
is
Yeah.
absolutely sometimes the last thing that they need. It'll stress them out. Like, I mean, very often, see, one of the things I'm kind of concerned about now is I'm dealing with teeth that are abscessed. Then you got to make the decision. You got to tell the family, okay, well, you have an abscessed tooth here. Your family member is not in pain.
Mm-hmm.
It's possible that if there's a fistula, hallelujah, as they
Mm-hmm.
say, well, it appears to be draining. It's as long as they're comfortable, we're going to just sort of treat it um, minimally to
Mm-hmm.
just make it easier to keep clean and put some SDF on it as well, and we'll watch it.
Yeah.
But when you get in there and want to surgically remove something that it's going to require an oral surgeon or a visit, out of the assisted care facility to the oral surgeon's office. I mean, that's so traumatic to the person, and then even the whole healing process after that.
Yeah.
it's cruel to me. It's kind of cruel and unusual, which is what I basically think of of anybody who's drilling into a tooth for to remove a cavity
Yeah.
that that is so unnecessary. But how do you
Or
change?
shoving a periodontal probe into their sulcus for a measurement that's completely subjective.
Yeah, yeah. Well, and people do that because who needs it? Insurance companies and the
And yeah, you
they,
know what? I'm
but
I'm digital, digital impressions have gotten a lot better. So I'm hearing that there is going to be like digital imaging of the sulcus rather
well,
than,
yeah.
measuring with a metal probe.
So that's the world we live in. It's in a state of change. That's exciting. I like being in this space. I'll tell you. So my gift for my colleagues that get to be of a certain age, like my age, that have been through all the stress. I mean, I have prepped 100 veneers in a day. I have, done full mouth cases under sedation and had even under conscious sedation, sometimes people come out of it and you can't get them back into it. And I'll tell you,
Ugh.
the stress, the when if your stress meter goes to 10, I've had days where it was on 15. Dentistry and hygiene can be very stressful professions. I
Yes.
totally appreciate that. For the wellness of my colleagues, I'm really not. I'm very much in favor of what I think is in the best interest of the patient, but I want to take care of all of my colleagues too in hygiene in the dental world. And especially if they're to the point where maybe their hand-eye coordination not the same as it was, or with me, it was kind of I couldn't like I wasn't handling the stress all that well. I mean, I thought I was, but the migraine headaches I was getting every couple times a
Oh,
week was telling me something else.
yeah.
And since I pivoted into this new model where I'm using medicinal care to fight decay
Mm-hmm.
and to fill in voids with the glass ionomer cement and doing everything I can do in the dental chair with no shots, no drills, no suction, no plumbing.
Mm-hmm.
I've got nothing, and I can take this model anywhere and do it. Anyway, the stress level is gone.
That's awesome.
And to me, I'd love to give this gift to my colleagues if they because there's burnout in dentistry. Actually, I will tell you something, Beth, that I was chosen to be a wellness ambassador for the American Dental Association. So I'm going to be doing that in the coming year. I'm getting onboarded
Wow.
a week from today, and then in 2025, I'll be a wellness ambassador for the ADA. And my goal is to help guide colleagues to the resources that are already there.
Mm-hmm.
But if they are burned out by the stress of dentistry, I just might at some point tell them about what I'm doing and how
Absolutely.
it's a walk in the park of peace, joy, patients love you,
Serenity, Surdentity.
Surdentity. Welcome to the Surdentity Podcast Show, everybody. All right.
So
So yeah,
Surdentity is serene dentistry.
I know I like that. We gotta let's get serene. That's like that Olivia Newton-John song said, let's get physical. Well, no, let's get serenity, serenity. Let's get serenity. Let's all feel serenity. Let me hear
Well,
your body peace, your body snore. No, I don't know. I don't know.
well, so you know, you have as sleep dentistry starts to get more in more legs.
Oh, absolutely. Yeah.
Although it's it's not like people breathe fine all day and then all of a sudden don't breathe when they're sleeping. But what I want to get across too is these patients that you're trying to get sleep, these sleep patients and these patients that you hate, that you complain about, that are rude and uncooperative, they're the same people because they
They're cranky
can't
because they're not sleeping.
breathe. Yeah, they're not sleeping. They can't breathe. So that's why they're uncooperative in the dental chair. They can't breathe. And if we just help them breathe a little bit better while we're treating them, things are going to be like amazingly better.
Well, That's a wonderful space that you're in, and our mutual friend Shirley Gutkowski and her
She's a
Primal Air
goddess.
business is just down the street. Well, it's actually on the other side of Madison from me, but we've been in the same city forever, and I would say that that I've been really blessed to know Shirley Gutkowski and have crossed paths with her as a like a temporary hygienist. She's dropped into my office from time to time. I'll never forget the time when she said, because as a hygienist, you gotta every time you're in a new office, you kind of got to get, well, what's the
Hmm.
lay of the land here? Like, what do you consider a problem? It's like
Right.
some docs might say, just polish them and send them out the door. Tell them to floss more. So polish them, tell them to floss more, and say goodbye. And then reschedule
Hmm.
them. Don't forget to reschedule them. Whereas, I told Shirley, I said, well, my policy is that we accept no bleeding. So that's disease. So we're gonna move people towards therapy if there's bleeding. And she goes, so you got a zero tolerance for bleeding. And I said, yes, that's exactly what it is. And that sort of became our little catchphrase for a while. ZT4B.
ZTB,
Yeah,
ZT4B.
which then Bill Dom took that and kind of built a website around it and with all the resources as to how your gum disease connects is correlated and connected to your systemic health. Oh gosh, listen to us. We're all over the map, aren't we, Beth? But all right, I'll tell you why we're all over the map, folks. For those of you still listening, is that this is not just a punch the clock job for us.
No.
It's a passion, it's a mission, it's a purpose. And I think all my career, I kept thinking, like, what am I supposed to be doing? I always felt like that, like looming out there is a very significant purpose. And I was very, very patient because you get to be my age, most of my colleagues are done with their career. And I'll tell
Mhm.
you something, mine just opened up, mine just started. And
Yeah.
it's very, very exciting. I can't even, the thought of retiring, because I really love what I do, and I would wish everybody could feel that way. I know Beth
Yeah.
feels that way because you've pivoted. I've pivoted. I'm still a dentist, but I've pivoted into the area of dentistry that nobody else is in. That you won't
Right.
find another dentist in the country. I hope you do. I'd love to be that person's friend because I think we could, share notes.
Right.
I do know one. Jeremy Horst Keeper is just opening a practice I believe, in San Francisco that is going to be drill free, and
Wow.
and he's one of the major researchers in the medical management of caries field, and he's been he was worked for CareQuest for a long, long time. He's a researcher. Anyway, super good guy to be in this space and to also be developing a business in this realm, which
Wow.
I believe there will be a there'll be now my brand is called Victorious Dental because who's helping you win the battle for your own health? We want to be victorious. Um, but I believe there's room in every city in America for a medical management of caries
Absolutely.
office. And so maybe we don't have one now, and maybe right now mine's the only one, or soon Jeremy Horst Keeper will have his up and running, which maybe it is by now. But anyway, but I've been doing this for 5 years, and primarily sort of did it kind of coincided with COVID. I was I was going to go into the realm of air abrasion and laser and ozone and just all
Hmm.
those things. I still wanted to open up a practice with no drill, but when
Right.
I learned about the how powerful and simple SDF, medical management of care, is, I just said, this seems to be the best way for the masses.
Yeah.
I'm fine if somebody wants to halt their decay with ozone or with laser or with air abrasion, and they want to do some conservative. And there's
Hmm.
always going to be drills. Okay, but um, to reach the most people the quickest and I think the most effectively, because SDF does shut down decay. It is a
Hmm.
miracle. I went to Bolivia. We saw 200 kids. We did a research mission there,
Hmm.
and the study's coming out in a couple of months. But my favorite example was this 6-year-old child with 27 areas of active decay.
Oh my God.
And on day one, we saw this child, and he was in pain. He was in pain. But I'll tell you what, all those Columbia kids, or I'm sorry, I say Columbia because my assistant's Colombian. All these Bolivian children were were such good patients. And my Colombian assistant keeps telling me it's because Americans are so spoiled. Like, they're having a fit just sitting in the chair and you haven't done a
Right.
darn thing. So there's
Right.
that.
Right.
We had the sweetest, most loving. I just love these kids. And anyway, we did all the medicinal care. But my favorite example, but this was a lot like most of them. 27 areas of active decay and in pain. On day one, we put the SDF
Mm.
on, sealed it with the fluoride varnish. On day three, another round of SDF and the fluoride varnish. The studies show that you do SDF one time, you're going to get a 60% reduction in your risk of tooth decay. You do it two times, you're going to get an 80%. Okay. Now, what we didn't do was seal all those areas up with glass ionomer cement.
Hmm.
That would have put us up to 96. But
Right.
the point of the study was simple care. Come in, swoop in, do the
Hmm.
two treatments in a couple of days. Come back 6 months later, Beth. You
Yeah.
ready? You better be sitting down. You ready?
I'm sitting.
All 27 areas that were actively decayed, was active decay. Like it was decay, it was moving and expanding and, getting worse and worse. All 27 areas had been halted. We say in dentistry, we call that arrested. The
Wow.
decay had been stopped and no pain. Little child, no pain. So just to use that as an example, that's what is available here in America. Everything good in America, except dental care in America. They'll put a drill in your tooth in America, but not at Victoria's Dental, which
Not at
is in
Victoria's
America.
Dental.
Correct. That'll have to be my next song. You've heard my other song, haven't you? The drill is
Yeah,
gone.
you did that song at, didn't you do it like Dentistry's Got Talent or something?
No, but I did. I think I lectured at one of those meetings, and it goes a little like this, and I'll just sing a little bit. The drill is gone. The drill is gone away. I said the drill is gone, baby. The drill is gone away. I refuse to harm your precious teeth. There's a better way to treat tooth decay. The drill is gone. The people glad to see it go. Bye bye, drill. I said, the drill is gone, folks. I buried it out back 6 feet below. Every dentist gonna get nervous because those damn things just got to go. That's just a little smidgen of the song,
That
but
is amazing.
give you a little taste of what I try to
So
talk about, sing about, whatever. But
I sing The Thrill Is Gone with my band. The thrill is
well, I'm going to ask you
gone.
to change that to the drill is gone, then,
The
please.
drill is gone away.
I'll send you the words.
Oh my gosh. So you remind me of me, and and I think this is, we're both very blessed to have something that's gifted to us. We were born with it, and it's empathy, but it's this desire to when I saw patients, it's not just about cleaning their teeth. It's
Right,
not just
right,
about,
right.
it's about, I want to be a force for positive
Yeah,
change, and healing. There's healing and then there's curing. And you can heal somebody that's still dying of cancer. Okay? It's healing is when we allow our spirit to connect with that person's spirit and something happens.
mhm.
And that's why that's
But where I'm gonna now, where does it start though? What is it about you that, that where that magic happens? What is the deal there? What is it?
you know um
What makes you even care to be that for somebody?
that, like I say, I think that it's partly gifted. It's partly part
Oh,
of
I swear that part is true, but I'm gonna go a little deeper, but I'm gonna see if you got it.
it. Well, it's become a passion. And I'm passionate about it because it works. When I
Simple. I know.
connect with somebody and they feel better, it's win-win.
Sure. But I'm going to say that you couldn't do what you do if you just didn't absolutely just enjoy this gift of life.
Yeah.
You have that blessing, and I wish that's the thing I could share with people. It
Yes.
is like it is an appreciation that of being alive and what a gift that is. And I through the grace of God, I feel that oftentimes throughout the day, and I go, wow, I do. I mean, it's real. I just go, wow. In this moment, I am appreciating what it is to be alive. And what is it? Is sometimes it's just the weather. Sometimes it's just I'm walking and I'm
Yeah.
seeing, and
Yeah.
or I'm with my grandkids, or or I gotta tell you my favorite story because it'll make me cry, but I don't care. I'm gonna tell it. But this is what I'm talking about, the joy of life, the joy of being alive. At the nursing home, I was working with a husband who was bringing in his wife, and she was suffering from dementia. We weren't sure we were even going to be able to get her into the dental chair. Now, at this one nursing home, they have two dental chairs there.
Hmm.
Most of the care I give prior to working with this nursing home is just I go to the room, or we
Yeah.
set up in the hair salon or whatever.
Sure. Yeah, I did the
Anyway,
same. Same.
my heart just like I am so on the side of the caregiver when I realize like my life is so how'd I get so lucky? Like,
Yeah.
but or maybe there will be a time where I will be doing what this husband, this loving husband is doing, but he's so gently, carefully, and patiently
Yeah.
dealing with his wife who's she's suffering from dementia, so sometimes she's belligerent or angry
Yes.
or just flailing,
It's awful.
and and so I'm on his side. So I'm going to do whatever I can do to get his wife into the chair, and it's going to take a little extra time. Going to take some quiet, focused talk, maybe a little distraction, but all kind beautiful, wonderful things that I love to do. Now, after going through that for it wasn't like maybe 10 minutes or so, we finally got his wife into the chair. We were able to do the care, and that way, when we were finished, the husband looked at me and goes, and this is the part that gets me. He says, there's a special place in heaven for you. Saying that to me. But I said back to him, I said, do you know what? I'm in heaven now. This is heaven to me. Like if I could, like I said, it's gonna choke me up. But it's so because I so love life. I so love helping people get through life.
Yeah.
And if I can go to heaven and do that every day, that's heaven. And how did I get so lucky? I'm living in heaven here on earth. So
Yeah.
I feel like the most blessed kid on the planet. And that I had to share that story just because it wasn't anything I was prepared to say, but it just sort of when he said that to me, it's just like I wanted to tell him I really love what I do. And this is I guess to have this is a gift, and right, and so much of it is what you said, Beth, at the very like somehow I feel like I was chosen for this, so like
Hmm.
somehow I got to enter this world as Chris Kammer.
Yeah.
I didn't have anything to do with that. I zero to do with that.
Yeah.
um and I just sometimes when I can acknowledge and appreciate it and feel all the miracles and walk every day in heaven. Well, can it get much better than this?
Yeah.
So, and that's not to say there aren't challenges.
Right.
Let's
Right.
just be
It's not
clear.
right. Life is life, right? Life keeps lifing and challenges happen. And some days you get frustrated, but I still, at the very core of my spirit, is joy.
Yes, yes. And your joy and joy happens when you just can't hardly believe that you're alive and that life is a miracle. It's a gift. It is and my heart does break for
Yes.
those that don't feel that,
Yeah.
and that's why I wanted to be an ambassador for wellness for the American Dental Association. Like when you got it, and that's what I was going to say about you. When you got it, like you do, Beth, you want to give it.
Yeah.
You don't want to just, oh, I got it all. It's all mine. All this, it's like that don't feel so good. It's like, you want to help
Hmm.
other people. It's like we're all meant to be with one another. It's like that Barbara Streisand song, because people who
People
need
who need
people
people.
are the luckiest people in the world.
We're children needing other
Go
children,
get it, Beth. Yes. And
but somehow letting our foolish pride hide all the need inside. Till
awesome.
we're more like children than children.
Wow. I wonder how many more. By the way, very nice. I wonder how many more songs we're going to get in before we wrap this up. But
Well, no, we've been on here for 45 minutes.
well, it's really been fun to be here with you and to sing with you. And I will tell people that we have sung together
Yes.
uh, at one of
Yeah, that was
the
great,
dental
by the
festival
way.
with
You brought the
Smiles at
house
Sea.
down with that.
I know, but it's so. First of all, and people must know you're a singer because you are. And is this? But this can't be the first Surdentity podcast webinar that you've sung on.
It might be.
Oh my gosh! Well, people, you better start asking for more of it because this woman can sing. She's got the gift. You see, I don't really have the gift of singing, but I sing anyway. I don't care.
Right, right.
And that's another thing I wish I could give to people. Like I feel like when I'm out there singing, I'm hoping that I give people the permission to go, well, he ain't that great a singer. You're right. You're right. And yet I love it. It's fun. And I would like all of the people that in my sphere to have that joy as well, or at least to not have that fear, because
Hmm.
there's so much in life to be joyful about. And and if you can't find it yourself, give it to someone else and watch it come right back to you is
Yeah,
just how sometimes it works.
yeah, yeah.
Yeah.
And but just real quick, things can get in the way of that, of course. And you know, uh, even though the core of my being is joyful, there were times in my life where I had to really do some work to kind of get some stuff out the way
Yeah.
so that that joy could come out again.
Yeah.
And
Yeah. Sure.
that's another message to my fellow professionals. If you're struggling, get some help.
Amen. 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 There's help out there. It's good. And yeah, and you know what else? Like help could be any number of ways. Certainly therapy. I have had a therapist and for years and years, and
Mm-hmm.
I've found that to be extremely helpful. And also there are people I've always enjoyed being one of my favorite things about the church I go to is when we would have regular men's group meetings, and
Yep.
you'd have these men getting together on a Saturday morning, telling their story, and everybody's crying and hugging and praying, and
Mm-hmm.
it's so healing.
Yeah.
And we all think that we have these secrets about who we are and what we've done that would be
Right.
so embarrassing to tell everybody.
Right.
And one of my favorite sayings is that you're as sick as your secrets. In other
Yeah.
words, it's like, well, why did God put me through that? That was a really horrible thing.
Right.
Oh, but I wonder if it's that I'm supposed to now tell my story
Yes.
to
Tell
help the
our
next
stories so that
person.
other people, so that we can guide them through those dark times.
Yeah.
And yeah.
So that helps at least a little bit. You rationalize like, okay, maybe the Lord has you on this earth for a reason. Well, and there is one. Sometimes
Right.
it takes a while to figure it out and find it, but one of the best, especially if you feel like you've gone through some stuff that has been very unpleasant. It's like there's somebody else out there that's going through the same
Yeah.
thing,
Yeah.
and you tell your story. And don't worry about if it's the right person you're telling it to. The Lord will worry about that. Like they'll put
Right.
somebody in front
Right.
of you that needs to hear your
Yep.
story. Don't worry about it. And there's healing in the sharing, and not only for yourself but for anyone that might hear your story, because people feel alone in this world, and when they
Mm-hmm.
feel like someone else has kind of gone through something that I've gone through, they feel a little less lonely and a little more like there's possibilities. Like maybe I can get through this too.
Yeah.
Um, and I think, it's similar, but it's almost the opposite of people that dive into all the gossip TV shows to hear about the star that
Ugh,
is divorced or
yeah,
got in trouble or is in, whatever.
yeah.
It's like then they don't feel so bad because they feel like that person's
And
really down.
someone's suffering more than them. Yeah. And
But better to take the suffering that you're going through and share it in a like humble way, like, this is just what I've gone through
mm-hmm,
and I'm still working on it, or maybe I've bettered myself in some ways, or maybe I'm still where I started, but I'm working on it.
mm-hmm.
There's such a gift you might give somebody by just telling that story, because they won't feel so all alone, and maybe you'll inspire them to start working on it too. I don't
Yeah.
know. So I,
Yeah.
I love being in this space where sometimes people come to me and they go, "Oh, they said, when I grow up, I want to be like you, like, wait, I'm way grown up and you're way grown up. But what you're saying is you want to have that joy, that joy of life, that
Mm-hmm.
um, I'm going to be happy in my own skin, doing my own silly thing." And my daughter would always nail me on. She goes, "Dad, I got you figured out." Says, "You're comedy for one," meaning like I will entertain myself with my silliness, but
Right, right.
maybe somebody in my periphery will also feel less inhibited to see, well, if Kammer can stand up there and be a goofball, I could at least go sing a karaoke song or something, or
Mm-hmm.
something to get a little bit out of your shell. Because folks, life is so amazing and so fun. And there's so much out there for you. You just got to open some little doors and just
Mm-hmm.
walk through a little bit. And the more you do that, the more enriched your life will be, the more opportunities for fun. My favorite thing that Deepak Chopra said is that when you stand on the edge of the cliff and you're looking out and you're going, "I don't know if I should do that. I don't know if I should do that. Should I sing that song at karaoke, or
Mm-hmm.
should I wear the silly costume, or do something silly and fun?" But you're standing on that cliff, and out in front of you are all the infinite possibilities of what may come of the thing that you do.
Mm-hmm.
And some of them are so amazing,
Yep.
but you'll never have a chance to experience them till you take that leap of faith.
Right.
And that leap of faith. And who's really going to get hurt? We always think everyone's judging us, like, "Oh, if I do something fun, then people will judge me." It's like,
Right, right. We
there's a
judge
lot.
ourselves way more harshly than other people judge
Yeah.
us.
But yeah, it's funny because it's like, we think they the way we judge ourselves, we think everyone else is going to be judging us. But you know what? They
Right.
don't care.
Right. They don't
They
care.
don't.
Well, it's so here I'm living my life not by what I am and not even what I think I am. It's what I think you think I am. So, hello. I gotta be me.
I've got
I've
to
gotta
be
be
me.
me.
What's the next line?
I
"Do
don't
it
know.
or die, I'll reach for the sky. I just made up that
I
line."
like it.
Anyway,
All right.
well,
Well, we have been on here for almost an hour.
that's almost a wrong thing. But when we're on a roll, we love, you know what? We're
I
just
knew
sharing our
this was going to
joy.
happen.
We're just sharing our joy, and it's hard to stop. So, but at some point, we've got to let people get back to their
Right,
lives.
right.
But get back to that life, people, and bring some joy to somebody, and it will come back to you.
Yes.
And keep watching the Surgentity podcast show with your host, Elizabeth Dora Anthony. She's a former hygienist living in that myofunctional space, helping you breathe. Because I heard, and I could be wrong, but I heard, and it might not be true, but let's think about it. Breathing is important. That's what I heard.
What?
Somebody said that once. I don't know.
Right.
So
Breathing is good.
thanks for having me as a guest on your show.
You're welcome. And I will look forward to seeing you again.
We will see each other again. That's an absolute. All
Awesome.
right. Thanks, everybody.
Mwah.
Peace out, everybody.
Peace out.